Hello, and welcome to another episode of In Just 1 Minute or So. Today we're going to talk about what is a substance-related disorder. Let's jump in. People at all levels of society use substances for various reasons. Using a substance does not mean that a person has a substance-related problem or disorder. There are many factors that determine when the use of a substance is a problem. Substance use is a problem when use continues despite physical, mental, social, legal, and/or financial consequences. There are many types of substances that can be legally or illegally purchased, such as alcohol, nicotine, prescription and non-prescription over-the-counter drugs, caffeine, solvents, inhalants, and illicit drugs such as cocaine or cannabis. Both legal and illegal substances may alter a person's mood or a behavior. Not everyone will have the same signs and symptoms. The effect the substance has may depend on the way it is ingested, the age and/or gender of the person, and the amount and/or strength taken. Let's talk about alcohol-related disorders. Alcohol is the most widely used substance in Canada. It is found not only in beer, wine, and spirits, but also is a commonly used liquid, over-the-counter medications and products such as mouthwash and cough medicine. Alcohol makes people less alert and impairs concentration and coordination. In small quantities, alcohol causes people to relax and lower their inhibitions. They may feel more confident and often act more outgoing. However, alcohol can also make people more prone to aggression and other antisocial behavior. If a person is feeling suicidal, they are more likely to attempt suicide if they are under the influence of alcohol. In addition to the amount a person drinks, it is also important to look at the pattern of drinking. For instance, if a person may have 2 drinks daily, while another person has 14 drinks on Saturday night, although they have consumed the same amount of alcohol over the course of a week, the impact on their health is very different. While the weekly maximum is 10 drinks for women and 15 for men, it is recommended to drink no more than 3 drinks for women and 4 drinks for men on any single occasion. What are the harmful effects of excessive alcohol? Well, if we talk about physical effects, nervous system. Alcohol acts as a sedative on the central nervous systems. Loss of pain, perception, altered sense of time and space, impaired fine motor skills, and slowed reactions. Large doses taken over a short period of time cause sleepiness, anesthesia, respiratory failure, coma, and death. Long-term drinking may result in permanent brain damage, serious mental disorders, and alcohol use disorder. To the heart, it may weaken the heart muscle, increase blood pressure, or cause irregular heartbeat. In the liver, it may cause hepatitis, that is the inflammation or damage of the liver cells, cirrhosis, an irreversible lesion, scarring and destruction of liver cells, jaundice, skin appears yellow, and edema, fluid builds up in extremities. It decreases the production of blood clotting factors and may cause proneness to bruising or uncontrollable bleeding. The pancreas. The pancreas is also at risk because there is a risk of pancreatitis, a chronic inflammation of the pancreas. The muscles also become weaker. There is atrophy, pain, spasms, and tenderness. The stomach has irritation on the stomach lining. Ulcers as well, inflammation and bleeding. In terms of the reproductive system, the sexual functioning can be impaired and deteriorate, resulting in erectile dysfunction in men and infertility. Drinking during pregnancy significantly increases the chance of delivering a baby with fetal alcohol spectrum disorder. What about the bones? Well, alcohol interferes with the ability of the body to produce calcium. So they are weaker, softer, and thinner. In terms of the throat, irritation and damage of lining of the esophagus, and it induces severe vomiting, pain, and difficulty swallowing. Now, in terms of social effects, money, definitely. Regular use of alcohol can be very expensive. And in terms of work, being intoxicated or hungover makes work difficulty and the worker is less efficient. As for relationships, the use of alcohol can cause the breakdown of relationships. According to the Canadian Alcohol and Drug Use Monitoring Service, close to 11% of people who currently drink or did so in the past reported that alcohol created problems with their home, life, and marriage. And in terms of emotional effects, your personality is affected because alcohol is a depressant, not a stimulant, as many people think. It appears to intensify your present mood. For example, if you are happy, you relax, feel more self-confident and outgoing. But if you are depressed, you can feel actually more depressed. Alright, and that's all for today. Thank you for joining and have a good week ahead.